Murali Krishna, MD, and our program is underwritten by an educational grant through OSUMC Graduate Medical Education. A disclosure statement has been signed and is on file in the Graduate Medical Education Office. Today's Cloud CME is 2251. Dr. Krishna is a well-respected senior psychiatrist in Oklahoma City, Oklahoma. He is widely recognized for his dedication, passion, and mind-body expertise and skills for helping people achieve their true potential of emotional wellness. Dr. Krishna is a community ambassador and a board member for the Arcadia Trails Integris Center for Addiction Recovery. He also serves as the founding president and board member for the Integris James L. Hall Jr. Center for Mind, Body, and Spirit, an educational organization that's devoted to improving health through raising awareness of the healing power of the connection between mind, body, and spirit. He has also served as past president of Integris Mental Health. In 2010, Dr. Krishna and his family established the Dr. R. Murali Krishna Family Eliminate the Stigma Award to honor individuals and organizations that have shown outstanding contributions to the community by eliminating the stigma surrounding mental illness and improving the lives of those affected by mental illness. The respected award is given annually at the National Alliance on Mental Illness, Oklahoma Walk in Oklahoma City. Committed to improving the health of people in our communities, Dr. Krishna believes that each one of us has the responsibility to care for those in need, and he is grateful for the opportunity to create lasting positive changes in people's lives. He is an expert on emotional wellness and the mind, body, and spirit connection and how each one influences the other. Through his mental health and addiction recovery services, he has become an innovator and a champion for the people of Oklahoma struggling with mental health. He is often interviewed by television and print news organizations, and his tireless efforts have earned him in numerous national and international awards and recognitions. Dr. Krishna was bestowed with the prestigious honor of Distinguished Life Fellow, which is the highest recognition given by the American Psychiatric Association. And with the assistance of his good friend Kelly Dyer Fry, editor of the Oklahoman, Dr. Krishna wrote an inspiring and educational book entitled Vibrant: To Heal and Be Whole from India to Oklahoma City. While working together on this project, they discussed their shared dream with other community-minded visionaries of developing a world-class center for addiction recovery here in Oklahoma to address the crisis of addiction, mental illness, and trauma. Their dream became a reality when Arcadia Trails Integris Center for Addiction Recovery opened on May 28, 2019, on the Integris Health Edmond campus. Dr. Krishna is one of the 4 founding visionaries. It's a pleasure to introduce my esteemed colleague and friend, Dr. Murali Krishna.
Thank you, Jenny. I appreciate you. Good morning, everybody. Thank you for being here today. I'm proud to say that I have worked with Dr. Alexopoulos for over 18 years on the Oklahoma State Board of Health, and she has led many of those years of the distinction with her compassion, articulation, vision, and wonderful balance. She has proven what a good leader could be, and we are proud to, be associated with her. I'm associated with many, many doctors from your alumni, Palmer alumni, and Dr. Atul Walia is a good one that treats people with kindness and love in interventional pain management, and many, many other physicians. I'm particularly proud of the fact that the osteopathic physicians truly embrace the mind-body-spirit connection and its role in health and disease, which, I have really focused on for the last 55 years of my career as a doctor. So today we're going to talk about how do you keep balance, how do you develop resilient strategies and mind-brain skills, and why do we need these things? I'll briefly give an overview of the how multiple stresses affect us as physicians. Next, please. Next slide, Lisa. Lisa, can you move the slide? Thank you. Next, please. I have no conflicts of interest. So I'd like us to become more familiar with the body's response to stress, become familiar with the strategies to promote resilience in the medical community, and also become familiar with the mind-brain practices that can be incorporated into your daily life during your provision of clinical care or being a husband, father, and community leader, how these skills can help you. And so that's going to be my focus of the talk, and you'll have an opportunity to practice some of those skills. And Lisa has asked you to bring a piece of chocolate. Please don't eat it yet. I have an exercise. We're going to do it later on when we are working on mindfulness. Next, please. The physicians today face monumental challenges, unlike any in the entire history of modern medicine. Our sacred profession has not yet found a resilient way of responding to the challenge, and we are paying a heavy price. How so? Next, please. COVID-19 for the last 4 years has added enormous stress to physicians' lives because of multiple factors: inadequate options for testing treatment, more demands produce, perform, justify, loss of autonomy, and more non-essential, non-clinical work, paperwork, emails, reviews eat up so much of our time, repetitive exposure to trauma, illness, and suffering, and inadequate options and death. It has strained the whole system, and physicians are at the core that brought the brunt of this challenge last 4 years. Next, please. Almost half of the US physicians report symptoms of stress and exhaustion, a state of mental, physical, and emotional exhaustion and spiritual exhaustion. Doubting about our confidence and value of our work begins to evolve, and we start losing enthusiasm for the work. We become more like mechanical robots eventually when this takes over our life. Next, please. So what happens? We become the depersonalization, started treating people as objects, that patient in room so-and-so, or that patient, that condition, rather than a human being that's suffering from an illness that we would like to treat in totality. Our empathy goes down, low sense of personal accomplishment, and loss of meaning and purpose for which we went into medicine for. That results in irritability, low tolerance for frustration, anger, impatience, and cynicism. We're going to go into details, but I'm not going to do that because you know all the details from your own previous talks you've heard. I'm going to focus more on the skills you can do today and probably for the rest of your career. Next, please. The consequences, personal consequences: marital discord and higher divorce rate in physicians due to stress, 5 times more likely to abuse prescriptions, drugs and alcohol, higher depression and suicide rates, 70% higher for men, 400% higher for women physicians, and several hundred physicians die by suicide every year, and many become more vulnerable to illness. And you've seen so many premature retirements happening in medicine in the last few years, causing a shortage of physicians in almost every field. Next. What's the consequence of all this stress and exhaustion in physicians? Quality of care goes down, lower empathy and compassion, low professionalism, poor decision-making, more medical errors. Quality of patient outcomes go down, lower patient satisfaction of care, decreased trust and confidence in their physicians, decreased adherence to recommended treatment. Today, I read a report from Rhode Island how the public there are viewing physicians with less trust because they can't see the same physician 2 times. They have to change the physician next time, and that physician may not be as familiar with them. And so they're having some issues with that. So multiple stressors, and we are at the core of the brunt of the whole thing, even though we didn't cause those things. Next, please. So how do we do the resilience? What is resilience? We become resilient. Resilience is the alchemy of life that transforms the coal of adversity into a magnificent diamond of strength. As you know, coal is made up of carbon atoms, diamond is made up of carbon atoms, but the intense pressure and the heat that the diamond goes through makes it into a diamond of strength. Same carbon that made the coal becomes a diamond that is really the most strongest item we have on earth. So in a human being, resilience is the force that energizes an individual to grow through adversity or change by discovering one's own resources, abilities, and strengths. It's a force that you have that energizes you, helping you to grow through the adversity, stress, challenge, change, loss, pressure, demands by discovering your own resources, your own abilities and strengths. And that's what we're going to talk about today. What are those resources? How do you discover that? And how do you develop those strengths? And what skills can you evolve into that can help you throughout the career and the rest of your life? Next, please. You know, the stress affects the mind and brain and the body and the spirit because it affects the multiple processes and systems in the body, including the telomeres in the aging process. Telomeres are the end caps of the chromosomes that have specialized DNA sequences. And when the cell divides, the chromosome divides, the small part of the telomere is chopped off. So what research has shown, beautiful research done by University of California, San Francisco, Dr. Blackburn and her team that won Nobel Prize in Medicine, shows clearly that when you have stress, the telomeres chop off real fast. In other words, when you're experiencing stress, tension, pressure, hurry, then you are actually aging faster. And can you believe it affects the brain and the entire body that ages our heart, our skin, our internal organs, and multiple other things. Next, please. And we can slow it down. So the mind-brain interaction in health and disease basically talks about the pandemic, that how it changed our culture, our finances, education, food, transportation, employment, our spirit and emotions, most how people work, what they do in school and work. Most of those things are affected by the last 4 years of exhaustion caused by the COVID. And next, please. The stress may express to you as anxiety, fear, uncertainty, sadness, tiredness, insomnia, irritability, hypervigilance, changes in eating and resting patterns. Next, please. Impaired immune function. As you know, when you're stressed, the immune function goes down. Your GI, CV, and cognitive dysfunction happens. Increased alcohol usage, strained relationships, cynicism, depression, eventually result in physical, emotional, and spiritual exhaustion. Next, please. So discovering your own mind-brain health is the potential answer that will aid you to become resilient, protect and enhance your mind-brain health with skills that can be acquired. Next, please. So what are the skills of healthy self-care? You can give me talks on these topics, so I'm not going to detail about that. That is sleep, which is essential for good health and immune function. Sleep is very, very related to how you function, how your health is, how you age. When you're stressed, the hypothalamo-pituitary adrenal cortical axis is activated and the brain becomes hypersensitive and you start spinning thoughts and brain heats up. That is not conducive to sleep. And when you don't have adequate sleep, many functions in the body gets dysfunctional. The melatonin system that is very essential, not only for sleep, but protecting us from cancer. Melatonin, as you know, is a powerful antioxidant. Sleep is essential for immunity. Sleep is essential for the multiple enzymatic processes in the body to go properly, for the healing to happen properly. So sleep is going to be very important for you to focus on, not ignore it. Take pride in having good sleep, not take pride in having the least sleep that the culture is supposed to be teaching us. We have to have adequate sleep to be good doctors and stay healthy. That's very important. I have a talk called Sleep Like a Baby and Say Goodnight to Insomnia. I'm going to send that link to Lisa. If you would like, you can click on it and it'll give you the science of sleep and the practical advice how we can get good sleep like a baby. Healthy activities are very essential, along with balanced nutrition. I'm not going to detail because you're expert in that. Please have some time to play and smile and laugh and connect with people. That's very essential for our healthy care long term. Next, please. Develop healthy connections. That's a very, very core of staying healthy in the long term because you need others for mutual nourishment of spirit and love. And these connections are vital for our vitality and vibrancy in life. They're essential for thriving and they're essential for coping skills. Number one thing that you can develop is have at least a few close, trustful connections with others, two or three or four or five, where you share with others and the other person shares with you their ups and downs in life, and you support each other, give advice to each other, be there for each other. And that has helped me and helped multiple physicians that I've seen that have developed those healthy connections. Physician life is very lonely life in many respects, and we need to have our own colleagues and friends that we connect with on a regular basis to share with each other. That's very protective of your health. Next. So one of the important skills you can develop, and you will understand it today in the next few minutes, is the skill of activating your healing system. We talk about hypothalamo pituitary adrenal cortical system and how stress is activating it, how it is creating havoc in our body. But the creator has created an equally effective, equally strong, equally active healing system within your brain and the body by birth. Unfortunately, we don't learn about it until later on, and sometimes we have to cultivate it. The stress system, you don't have to learn about it because you start experiencing it whenever you see demand. The very fact of birthing process is itself stressful. As you come out of the calm, quiet, serene mom's womb into the world, they slap you on the back and the bright lights startle you, and the stress system is activated right away. So you don't have to learn it. You realize you have that, and you realize the effects of that. So what is the healing system? What does it do? It neutralizes the negative stress effects in the body and mind, reverses what we talked about the stress system does. It helps you find inner harmony and peace, which we are all looking for and which you can get. You will learn today that you can be part of that. You can acquire that. You can master that. Discover oneness with a power that's greater than you. Cuts down the excessive sensory input that we are bombarded with all the sensory input excessively, overwhelming us. It helps you discover or sometimes rediscover your vitality, your wonder, sense of compassion, and vibrance around you. Next, please. So, what are the healing practices to consider? How do you activate the healing system? First of all, the core of the healing system is the 10th cranial nerve, the vagus nerve, that is very central to the parasympathetic nervous system, the strong presence, strong force that is the core. As you know, the vagus nerve starts in the brainstem with separate sensory and motor nuclei, and it travels long ways through the pharynx and the larynx, supplying the striatal muscles there and the soft palate, and supplies the ear and goes through the esophagus and trachea and goes down, branches off right side, left side, supplies the lungs and the heart and in the abdomen, spleen, liver, kidneys, intestines. It practically all the thoracic and abdominal organs are supplied by the 10th cranial nerve, the vagus nerve. It's a long nerve that has a long cord. It's got afferent fibers and efferent fibers, both motor and sensory fibers. It's good to understand that because we need to understand the basics of how we can activate our own healing system within that you possess and everyone on the earth possesses. So how do you activate it? If you activate the 10th cranial nerve, the vagus nerve, through any of these skills, you will be having wonderful response. Deep breathing, meditation, guided imagery, prayer, deep meditative prayer, yoga, nature, walking in the nature, being in the nature, working with the nature, music, art, creative aspects of life, dance, humor, laughter, other creative endeavors. All these practices activate your healing system. In other words, through any of these practices, you can activate the neutralizing healing force that's you're born with in your life, that you're born with, but we have to activate it and master it. As you know, the brain and the nervous system, you can rewrite the anatomy and the physiology of the brain to some extent to help you. And part of it is activating the healing system. So you'll have a pathway to skill development. So we'll do a few of these in the next few minutes. Next slide, please. So I'd like us to get into the skill and gift of mindfulness. But before that, I want you to have the basics of the deep breathing technique. There's so many books written about it. There are so many theories. But physiologically, deep breathing has a lot of meaning to activating your healing system because the vagus nerve receptors are lined in the diaphragm and the chest wall and the lung walls. So if you take a slow and deep breath to fill your lungs all the way to the bottom of the lungs, to the diaphragm, naturally keep the abdomen soft. It may protrude a little bit, but when you take a deep breath and hold it for a few seconds, and then slowly let it go, your healing system is activated. It's as simple as that. Musicians do that. If you watch NBA or the college football, basketball, all the players do that deep breathing just before they shoot because you want to have a relaxed body and a calm mind for the best of your performance. Whether you're an athlete or a surgeon or a psychiatrist, you got to have a relaxed body and a focused, calm mind to give the very best of you. Your focus is better, your healing system is activated, you feel calm, you feel at peace, so your memory is sharp and your delivery is wonderful. So these skills can be learned. So I want you to practice with me just 3 breaths, slow, deep breaths. Breathe through the nose, close your eyes, breathe all the way to the bottom of the lungs. Hold it for a few seconds. Slowly let it go. One more breath. Last breath. Open your eyes. If you do it for a few minutes, body becomes relaxed and the entire musculature is so calm and relaxed. The pulse rate goes down, blood pressure goes down, and internally, many systems start showing changes, neutralizing any stress reaction that you have and getting you into much more relaxed state with the multiple enzymatic and molecular changes happening within you. You may say, Dr. Krishna, I don't have 20 minutes of time doing the deep breathing. You don't have to have 20 minutes of time. Incorporate everything I'm talking about today, all the skills I'm going to talk about today, you can incorporate into your daily life. You don't have to spend one more extra minute. Can you believe that? And you can have all the benefits out of it, and including mindfulness, which we're going to get in a minute. So when you're driving a car, keep your eyes open, but you can take slow, deep breaths. When you're working on the computer, you can take slow, deep breaths. If you can cut down the breathing rate to 6 per minute, It does wonders for you. Amazing health benefits, amazing stress coping skills, amazing sleep. Marvelous things happen to you. Teach that to your patients. It does wonders for you. Pain perception goes down. Immune system goes up. Amazing changes happen internally. You can see in the body and the brain even, which I'm going to talk about in a minute. So please incorporate slow, deep breathing. When the Oklahoma City bombing happened in 1995, I was chief of staff at St. Anthony Hospital, 800 medical staff, and I was co-leading the rescue efforts. And we had literally thousands of people flock to the hospital, and many of them are anxious, worried, frightened, and of course, several of them have serious physical injuries. And I put a camp in the basement, and I taught them the simple breathing technique because you can't spend time with each one of them. But a simple breathing technique of slowing down your breathing to about 6 per minute does wonders for you. Amazing wonders for you. It's a powerful healing practice. Simple yet powerful. Incorporate that into your life. That's very important. Next thing, which is a power skill that actually you and I and every human being is born with it. That is the mindfulness gift. It's a simple yet profound skill to cultivate with potential for immense and positive impact on you. So what is mindfulness? Mindfulness is cultivating your awareness, your cognizance, your awareness, the real you. Being in the present moment, non-judgmentally. Being in harmony with the present moment. You are here, you are in the seminar, and you are trying to learn a few things and incorporate them into your life. The mind takes you somewhere. I wish I could be doing something different, or you forgot something about the patient, or whatever. Bring it back to the present moment, non-judgmentally, and being in harmony with the present moment. Embrace it. Be one with this moment, whatever it is, whatever you're doing right in front of you right now. It can be applied in all aspects of life, every aspect of life, including your daily functions, seeing patients, talking to patients, examining patients, working on your computer, reading a book, listening to music, walking in the nature, having a mindful shower. You know, when you go into the shower, a lot of the times we have a mindless shower. I have a mindless shower usually, used to. You know, before you know it's over, we don't know what happened. But if you have a mindful shower, focusing on each sensation, it becomes a mindfulness exercise without you knowing about it. That's amazing, profound effect. So next, please. So what are the benefits of mindfulness? Before you do exercise, we'll learn a little bit about what does it do to you. It brings inner peace and happiness. You start enjoying life in its purest form as it was intended by the Creator. Tones down the stress response significantly and enhances control over impulses, emotions, and reactions. It's amazing. And our resilience improves as well. Long-term studies show with the Army, Air Force, and other armed forces, as well as multiple studies done in the United States, that the resilience, remember, resilience is that force we talked about that activates your own inner coping skills and your own inner strengths. Resilience improves dramatically with mindfulness practice, regular mindfulness practice. Once again, you don't have to have 30, 60 minutes extra every day to practice mindfulness. Incorporate mindfulness into everything you're doing, everything you are, you know, cultivating that awareness. And we'll know practically in 1 second how it is done. Next, please. Tremendous changes happen in the mindfulness and brain with mindfulness practice. Prefrontal activation happens. You can see on the scans within 6 weeks, prefrontal area right here is activated, which is the seat of judgment, insight, wisdom, and decision-making. Amazing, isn't it? Learning and memory impacted positively. Even the size of the amygdala, long-term studies are showing from Harvard that it right-sizes the response of the amygdala and the HPA axis. Amygdala is hyperactive, HPA axis is hyperactive in excessive stress, and it right-sizes it even not only functionally, but even anatomically, you can see in the scans. It enhances the neuronal connectivity, especially those areas that you need the skills in. Next, please. Go back to the last slide, please. Okay. Now, I want us to just have a taste of mindfulness. The first part, I would like you to take mindful breaths. This time, when you're breathing, you don't have to breathe deep or slow. Just mindfully aware of your breath going in and out through your nostril. Close your eyes for a couple of minutes and be aware of the air going in through your nostrils. Feel the air, the touch of it, whether it's cold or warm or neutral, the speed, velocity with which it's going in and out, the moment of it. Do you feel any sensation, tingling, or vibration as it goes in and out? Notice how with each in-breath, the chest expands, and with each out-breath, it contracts. Notice how the temperature of the air changes slightly. It becomes more warmer in the lungs. So the out-breath is slightly more warmer than the in-breath. Just notice and be aware of the sensations and the moment, the mobility and the velocity of the breath going in and out. Just as it is. If any thoughts come intruding you, or memories, or images, just be aware of it peripherally and let it go. Come back to your breath, which is your anchor. If it happens again, come back to breath again, over and over and over. Feel the breath going in and out. Just like a surf road experience, the wave going up and down. Ride with it pleasantly. It's calming, relaxing. Slowly open your eyes. Come back to your present moment. The eyes wide open. Congratulations, you have done a mindful breath. Breath is there with you all the time. This is a good pathway to discovering mindfulness. You are cultivating your awareness. That's when the inner tracks, neurological tracks are forming. We talked about prefrontal activation and the memory, the hippocampus, right sizing of the amygdala and HPA axis, enhancing neuronal connectivity. Remember the telomeres we talked about? It slows down the degradation of telomeres. You can slow down the aging process at the molecular level with mindfulness, as simple as mindfulness. It's amazing what you can do with your own awareness that you're born with. At birth, all of us were mindful. See, newly born, they're totally one with what's surrounding them. That mindfulness is very healing. Mindful way of life is a healing way of life. In going through all the ups and downs we go through, this is a beautiful, wonderful healing practice to do. And how do you apply mindfulness to everything else? And so I asked you to bring a piece of chocolate, and we're going to do an experiment of eating the chocolate mindfully. It sounds silly, but it's a good way of connecting with your sensations, which is really basis for cultivating your awareness for mindfulness. So please hold your chocolate. in your hand, whatever piece of chocolate you have. Usually I take Hershey's Kisses when I go to larger meetings and do the mindfulness exercise. They're very good pieces, small pieces enough. And watch and see how the shape and the size and the color and the consistency of this little chocolate piece is. Just appreciate the little piece of wonderful chocolate in front of you. And close it to your nostrils and close your eyes and feel the aroma. Smell the aroma, the beautiful, sweet smell of chocolate. Some of you may be salivating already. I would like you to just experience the aroma, the exquisite aroma of the chocolate. Keep your eyes closed for the next few minutes and gently but surely put the chocolate in your mouth and close your mouth. Don't bite the chocolate yet. Just swirl it around, see how it feels on the surface, on your tongue, on your cheeks. A small part of the chocolate may melt and you may experience some sweet taste, that beautiful, incredible taste of chocolate. Enjoy that. Take a small bite, just a small bite, and taste the wonderful chocolate in a memorable way, filling all your sensations. Just imagine for a minute while you're having the chocolate in your mouth, where it came from, how it was created. Chocolate is created from cacao plant, cacao fruit, which is grown in the equatorial countries like Ivory Coast. About half of United States chocolate comes from Ivory Coast. A loving farmer in a beautiful climate, about 70, 75-degree climate, warm climate, with decent rain, love of the farmer and the family, and nutrients in the soil. They make the chocolate tree grow, the cacao tree grow. And then the photosynthesis makes the nutrients into the sweet chocolate fruit, cacao fruit. As you know, it takes about 8 minutes for the photons from the sun reach the earth and hit the leaves of cacao tree. But you know, it took 5 million years for each photon molecule to be made inside the sun. And those photon molecules made the photosynthesis that made the chocolate. The cacao fruit is harvested and fermented and dried, and the chocolate seeds are sent to the United States to Hershey factory in Pennsylvania, where they're properly treated. Appropriate nutrients are added and roasted to perfection by loving workers. And they made the little piece of chocolate that you're experiencing. You can bite the chocolate, experience all of it. Let the taste go around in the mouth, through the palate, through the cheeks, and the tongue, as you experienced it as a memorable experience of eating this sweet, wonderful, delicious chocolate. Enjoy it. Be one with it. Completely be immersed. It's an incredible experience you're having. Chocolate has many, many good things in it, including wonderful nutrients that are good for your brain and the lungs, polyphenols, number of other good things. A small piece of it is teaching us how we can connect with our sensations and have the joy of being mindful. You can finish eating the rest of the chocolate, but carry in this memory a long time to come. Slowly open your eyes and come back to awareness of what's in front of you. I wish it was completely live. We could share the experiences you have had. Almost all the time, many of in the audience will ask, where did you get that chocolate from? It's so special. But you wouldn't be doing that because you got the chocolate today. It is a simple example of how we can connect with our sensations. We can be one with what's in front of you, non-judgmentally, experiencing what is. And this is a small example of how each bit of our life was meant to be experienced by the Creator. But the modern life and the busy lives we lead has taken away, and our life became more mindless than mindful. In fact, surveys show that most people in the world, most of the time, they're not mindful. They are either in the past moment, what already happened, regretting it, remorsing it, feeling guilty about it, feeling angry about it, or the future, worry about it, anxiety about it, concerns about it, wondering about it, barely in the present moment, completely with full mindfulness. This is not just up in the mind. Mindfulness of each moment benefits every molecule of you. It is almost like tune-up for your whole brain and the body, preparing you for this life, helping you cope with it and live through it with joy. Each moment becomes joy. So I recommend that you practice mindfulness with simple activities. Breathing is very simple to practice, or all activities that you're involved in. Apply to your sports. If you're playing tennis, I apply mindfulness to tennis. In fact, when I was consulting with the Thunder team, they were consulting with me actually for several years. I taught mindfulness to many of the athletes. And I can see within a few months how their performance went up and up and up with serious mindfulness practice. It brings the very best out of you, whether you're a surgeon doing complicated procedures or a family doctor seeing complicated patients or simple patients, or an athlete or you're a speaker. It brings the very best out of you. Mindful way of living is the way the very best of humanity and human being comes out. Plus, you don't age as fast. Isn't it amazing? You still have vibrancy left in you as you practice. I know I'm going to be 75 in a few months, and I have same degree of enthusiasm for what's going on in life today than compared to what I had 55 years ago when I became a doctor. And part of it is because of mindfulness practice, mindful way of living. And please practice. This is very core of your health. You will have the tool become part of you, and you have all these beautiful things happening within you. Even at the Arcadia Trails Addiction Recovery Center, we incorporated the mindfulness practice very actively with amazing results. As you know, the impulsivity goes down with mindfulness practice. Within a few weeks, you can see that. The patient will tell you. There is a new amount of gap created between the thought and the impulse to act. That is worth uncounted value, worth $1 million. Because the less the gap between the thought and the impulse and the action, the more the problem solved with addiction, with impulsivity. And that goes down very much so, giving them more of a choice as to what's happening, how do you react to it, what are the best options to deal with that, rather than impulsively acting. So it helps you focus immensely. Quick reaction in a beautiful way by proper decision making, proper wisdom, proper insight, and your judgment will be much better. You can experience that in a few weeks to a few months' time. You'll start experiencing that. More importantly, inner calm envelops you. You'll have inner sense of serenity, calmness, in spite of going through everything. Mindful connection with the patients. So one of the best gifts you can give to the patient. Same amount of time. You don't have to have any more time than what you're spending right now. But mindfully connect with the patient, at least for the first few seconds, first few minutes. Totally focus on the patient. Put yourself in that person's shoes. Be one with that person. Amazing happens. Amazing relationship happens. Amazing healing happens. And as you know, your osteopathic physicians know better than anybody because you practice total whole body practice, whole mind, body, spirit practice, which is truly amazing. Next, please. Next skill I'd like you to consider acquiring and practicing and mastering is the skill of changing the perspective. What does it mean? There are so many situations in the world, in life, in practice, that we have no control over or minimal control over, but we face the consequence of that. And how do you cope with that? If you don't cope with that in a skillful way, it'll eat you alive because that's what causes stress, constant stress, anger, frustration, doubt, remorse. And that changes our whole mind, brain health. So this includes changing perspective of events, situations, relationships, surroundings, anything. Give me and I'll share with you how to change the perspective. You start seeing how to choose healthy options and how to choose the way in which you look at that event or that person. What does it involve? Reappraising your cognitions. Cognitions means thoughts, impressions, or attitudes. Reassessing the value of those thoughts, emotions, and ideas by reappraising the energy and the importance you put into a situation which cause those dysfunctional situations, or thoughts, and or feelings, or negativity. So that's very important. I can give you so many examples of that in daily life. Well, when I was serving in the Board of Health, I think Dr. Alexander was still there. We had to take a stance about the marijuana and the pharmacist prescription. And we took a stance, very strong stance, for the health of the patient and the community, what's best for it. Then all kinds of telephone calls coming in. As you know, I lived my life, most of my life pretty peacefully, especially last 55, 60 years. And almost all of my patients, I have a positive relationship. I rarely have any problems with anybody. I can count on one hand, any major issues I've had. So suddenly these calls are not like that. They're not appreciating you or praising you or commending you. These calls are criticizing you, blasting you, really horrible language, and some calls came from Colorado about some people really blasting me about the position I took on the State Board of Health. It hurt my feelings that somebody did not like what I did and they're mad at me. But then I couldn't sleep for a night or two. Then I realized I need to change the perspective about the situation because I can't change that. I've taken a stance based on what I read, what I experienced about the drugs and the marijuana and the effects and how to safeguard our patients and our community. And I stand by that. But I have to face the consequence of some people not liking it for whatever reason. They may have their own perspective, whether it's economic or emotional or scientific or whatever. So I said, I will stop giving value to these calls and that they don't determine how I feel about myself, my work, and my mission. And that they have their own opinion. I respect that, even though I disagree with that. So I changed the time I spent in thinking about it, the value I've given to those calls, the energy I put in that, the emotions that surrounding I detached from it, because I reappraised the time and the energy and the importance I put into that situation, which has caused my dysfunctional thoughts. I can't please everybody all the time. You've got to take a stance based on what you know and what's good. And if that is not liked by everybody, that's fine. That's life. That's a very simple but silly example, but you can go through situations with patients, situation with employers, insurance companies. You struggle with insurance companies a lot, sometimes for approvals, and that causes stress to us. And we need to change the perspective so that we can stay healthy and still functional, still very effective. It's a very healthy way of doing that. So you're not left with the residue of stress and its effects on your body and your mind. Next slide, please. Next skill of stopping churning. By the way, the earlier skill we talked about, changing perspective, that applies to daily life. And whenever you're having distress in your body or your mind, or doubt, or difficulty in making decisions, think about what perspective you have that's causing the issues that you can't change. Of course, you can change, you go and change, but many situations we can't change. So act by choosing the options you have available, how you can become the winner and not the recipient of those negative interactions. Next skill that's very important, especially for doctors that are kind of perfectionists like me and like many of you, sometimes churning happens, which is a repetitive negative rumination. Worry, 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 worry. It stresses us, it ages us, telomeres chop off real fast when you're worrying and worrying and worrying. And when you're worrying, the churning produces more heat in the brain. The actual studies are done. And that prevents you from having good sleep because a hot brain is not good for sleeping, not conducive to sleeping. And not sleeping regularly can cause problems by themselves, like we talked about. So learn the art. Once you recognize you're churning, you're thinking over and over and over with their thoughts of usually anger, frustration. It happens. I used to get so angry when the insurance company is taking their own sweet time for my patient to have certain care or denying care, not knowing all the details. But then I realized there's no point in churning about it. Look at healthy options, how I can deal with that. Redirect my thoughts. Give the evidence that they're looking for that'll help them to feel convinced about the care that the patient needs, that I think the patient needs. For that, I had spent time, enormous amount of time, in the beginning part of my career. Later on, they realized I'm not going to let them get by. So they started giving me easier approvals. Intentionally redirect your thoughts to something that you have control over. What is it you can do about that? That is more positive, more constructive, and find peace in the moment. Churning happens very frequently to many, many doctors. I've seen thousands of doctors in my 55 years of career. As patients, they consult with me about stress and burnout often. And we have to stop. We have to develop the skill and practice the skill of stopping churning on a regular basis until it becomes part of you. This again, the more you practice, the more you become proficient and more it becomes natural for you. That's an important thing. Same thing with mindfulness. The more you practice, the more it becomes natural for you. Then the intruding thoughts stop coming so frequently. And that is something that will stay with you for long term in protecting your health and enhancing your life into a vibrant life. Next, please. Learn the art and the skill of giving yourself positive feedback. If you watch yourself, whether it is in practice or dealing with people or in playing sports, we are our worst critic most of the time. We criticize ourselves. I wish I didn't do that. And we sometimes even say, dummy, why'd you do that? I do that in tennis a lot. Dummy, why did I hit the net? I should have gone over the head. So this self-critic is built into your mind and inside our brain. We need to negate that because if you don't do anything, those negative self-critic will take over you. No, you're human. You're less than perfect. And you can't be perfect all the time. Sometimes we do mistakes. Sometimes, and we learn from them. So learn to give positive rebuttal, positive statements to yourself over and over and over. What are some of the positive statements? I'm rising to this challenge. I'm excited to be a part of this noble cause. I can make a difference. I'm hopeful I have what it takes. I have the will to do the best I can. And you can develop your own positive statements. You can put on 3 by 5 cards and read them. Very important that you give the positive feedback because there's so much negativity going on around, especially when you're dealing with life and death and unlimited expectations and limited realities in life in medical practices. Next, please. Some of the other positive statements. This is the most meaningful thing I can do right now for this person. I'm confident I will give what I have. Good stress is oxygenating me now. By the way, studies are done that shows if your perspective is taking stress as a good stress, because you are under that situation to help a person and you're experiencing stress that is a result of that, but view it as a good stress that is activating you, motivating you, challenging you, bringing the best out of you, then there's more oxygenation goes in the brain. It's amazing how our perspective changes what happens here. I'm hopeful we can recover. I'm grateful for the opportunity to serve. Next, please. Skill of positive mindset through self-affirmation. Discover the meaning for your sacrifice and suffering. Find your core purpose. Find what intangibles bring vibrancy and meaning to your life. Intangibles. You can't touch, you can't see, you can't smell, you can't feel. But those intangible values bring vibrancy to your life and meaning to your life. What are those? Compassion, kindness, love. When you're in love or having loving kindness, several areas of brain light up. Without you saying a word, we can say if you're in love. Hope. Hope is so revitalizing. Reverence. Reverence for the creation. Oklahoma has the most beautiful sunsets you can see. I spend every evening watching the sunset, Oklahoma sunset, for the last 50 plus years. I enjoy it every time I see when I'm one with it. Beautiful creation. That's revitalizing us, re-energizing us. Gratitude. Think of few things you're grateful for that day each night. Mayo Clinic has done a study where just 3 gratitude statements at night time of things that are grateful for that day has a put beautiful effect on people's stress levels and their exhaustion and their burnout. These are the intangible things that bring vibrancy, the energy with which you can light up other people, not only yourself. And finding the meaning for all the sacrifice and suffering we do is very important. My mother's illness when I was 9 years of age, she suffered from a serious mental illness, brain disease, which at that time was not understood in India where I grew up, caused enormous strain for her and the family and pain, eventually her death. That's what led me to want to become a doctor. I used to want to become an engineer. And I think of her illness as the primary reason why I went into medicine, the reason why I'm practicing, or I have been practicing, and the reason why I go through all this trouble I go through, because there's a meaning behind it for me. It is my purpose. It's my purpose of life to have a healing effect on other human beings. It happened to create a beautiful profession, and you are lucky to work with many, many thousands of wonderful people. But when you have that perspective of what brought you into this healing profession, remind yourself of that. Every day and every piece of work becomes a piece of cake for you. You enjoy it. You have peace about it. I would like to wish you the best of luck. It's almost time. And thank you for your attention. And I hope you can practice some of these skills. Thank you so much.
Thank you so much, Dr. Krishna. That was just fabulous. I've seen you in many forums, both at the board level and in large groups of hundreds of people with guided imagery and self-care and all of these wonderful practices. So thank you so much for sharing that with our graduate medical education.
Thank you, Jenny. I appreciate you. I'm glad that we had this experience. Best of luck to each one of you, and God bless you. Thank you.
Thank
Thank you,
you,
Lisa.
Krishna.